Next up is someone very special that's been a really important person for this rally today. Her name is Angela. Angela is the executive director of the Silent No More Foundation. I'll let her speak about how that came to be. She's really been an incredible, Energizer bunny. And we love her, and we have formed partnerships with Show Me Your Stethoscope and Silent No More Foundation. Give it up for Angela. Thank you.
Hi, guys. I thought I had a couple more minutes to be terrified before coming up here. So, as she said, I'm Angela. And if you've been online, you know me as Angela Kokopeltiyo, though between us, that's not my real last name. It's actually Simpson, and I'm a registered nurse out of Salisbury, Maryland. And most of you, if not all of you, know about a story that came out of Delnor Community Hospital in May. And I won't get overly detailed about that story because probably you've already heard it, but 2 nurses basically had the unthinkable happen to them. And the initial story that came out of it was just that, they were taken hostage, but everybody was okay, no injuries, happily ever after. Over the next month, we had other accounts of it come out. And one day, the story really came out. And the way that I learned it was through a live video done by a gentleman named Zubin Damania. His moniker is ZDogg MD. So he had actually spoken directly with one of the nurses, and I'll call her hostage number 2. She is the one who was really brutalized and tortured for a few hours and raped and convinced fully that she was not going to leave that room in any other way but a body bag. So during this video, when he was talking about it, we were all riled up, and probably many of you were there hearing the same story at the same time as me. And I just decided, you know what? I'm done with this. Because it's not just happening here. It's happening everywhere. Every single hospital, any kind of healthcare facility, anywhere in the whole country and around the world is experiencing violence in the workplace. And it's being initiated by patients, and it's being directed at us. And there are many different reasons why this happens. Sometimes it's mental illness, sometimes it's just being disgruntled over wait times, sometimes it's because somebody got bad news. It's just bad. And in that moment, hearing that story, something in me snapped. Enough is enough. We cannot have this happening anymore. So I started a group, and initially it was a let's talk about this group, but then I realized we actually need to do something about this. We can't just not. So since then, we've grown to about 7,000 people, and I hope that those of you who aren't in it will join as well. It's called Healthcare Workers Protection Act, but as of almost a month ago exactly, we decided to become an official foundation called the Silent No More Foundation. And we are not going to rest until we have found a way to protect healthcare workers before, during, and after an assault in the workplace. And I hope that you guys will join in that effort. The fact that you are here means that you do care about this very much. But when you're getting statistics like 80 to 90% of all healthcare workers, or nurses in particular, are experiencing violence, and then you hear only 20% of them actually report it. This is such a huge problem. It's not just one thing going wrong over another. we have become so complacent in this that we aren't talking about it. This is a really big deal. We need to end it. And, you know, hearing from the legislators that have been here, with them saying, we don't know this is a problem, that doesn't surprise me at all. And I've talked about this with people who I know in my own face-to-face world, and they're like, no way, that's not true. And it's because nobody's talking about it. Nobody's talking about it. We aren't, the media isn't, God knows hospitals aren't. Nobody is talking about it. And this violence just doesn't exist in hospitals. This violence is in EMS, it's in outpatient facilities, it's everywhere. And nobody is talking about it. So that's why the hashtag Silent No More became a thing, because I'm sorry, but I will be silent no more. I will talk about this, and I hope that you guys will talk about this. And in the process of being silent no more, we need to talk to our facilities. You know, each and every one of you actually has the ability to ask your facilities, what do we have for this? What protocols are there? And if there's something that you hear that you think is kind of crazy, ask why. There's nothing stopping us from asking why. And I mean, in our own compliance and in our own feelings that nothing's being done about it, you got to ask yourself, did you personally try to do something about it? And there are so many levels at which that we can do something. So, you know, we start in our own facilities. Maybe our facilities could actually do part of their CEUs, self-defense, de-escalation. Maybe we could do something to reorganize the rooms that we're going into with these patients. But I'm not here to blame us. And I know I kind of started that way, but I'm not here to blame us at all. It is not our fault that we are being assaulted. And what's happening is those who are assaulted are actually being blamed for the assaults happening in the first place. Every single one of you out here who is in healthcare has likely witnessed or been assaulted. So when you look at that situation, and I'm sure you've turned it over 1,000,000 times in your own minds, could you have de-escalated that before it happened? Could you? I mean, honestly, I have never been in a situation where I have been assaulted or in a room where somebody's been assaulted where it could have been de-escalated. But people are being punished for it, for not de-escalating it. Why is this happening? This should not ever be happening. And then, when it comes to actually reporting it, I did find a workplace violence law that exists here in Illinois. And this law says that employers have the right to file for police action. Why are the employers making this choice? Why is it up to them? Hospitals are not motivated to have the general public hear that there's violence in their facility. So why is it that they are the ones being trusted to report? Guys, when we're asking for policy changes and when we're asking for legislation and when you sit down to sponsor a bill, we need to look at putting that power in the victim's hands. If I am assaulted on the job, I should be allowed to report. I should. And that should be left up to me only. You know, we're always going to have situations where, you know, our elderly dementia patients, they're going to get scared of what you're doing and they may lash out at you. And in that moment, we may recognize that, you know, charging them with that, maybe that's not exactly the right idea. But if we have somebody who's drunk, who comes into the ER because maybe they cut themselves in the head or something, and if that person starts throwing punches at you, shouldn't it be your choice to report? And shouldn't you be protected legally? You should have the legal right to actually report that and have absolutely no retaliation come from your employer. It's crazy to me that this exists. It is. So, I mean, when I'm looking through and I'm finding all these stories, you can tell that Illinois has actually slightly, they've slightly addressed this a little bit. Like I said, the employer could actually choose to report, but you know, it's not stopping whatever is happening. And the laws that do exist, they look at prevention. They may look at response afterwards, but they are not effective enough. It's not effective enough to have administration walk around the building and see what's wrong in the building. It's not effective enough. We are the ones in the rooms, and we are the ones who know where the vulnerabilities are in the rooms. We are the ones who see exactly how it is that we put ourselves in harm's way sometimes with our patients. So, you know, that is one thing that we need to look at. We also need to partner with law enforcement, because it's not just the idea of reporting. We need to know from a law enforcement perspective what is reasonable to ask for. I know that sometimes it gets complicated. If you have an inmate as a patient and you ask the CO, can you stand aside? And the CO says no. Well, that can get awkward. So when it comes to situations like that, I think that there needs to be mutual education between the COs and between hospital staff to know exactly what is reasonable. If you ask them to stand aside and they don't, you should understand the reason why. Or if they ask you to stand aside and you don't, then you should understand why. It's mutual. It goes both ways. So, before I step down, I want to share with you, in the last few days, and actually over the last 2 months since I got started on this effort, I received a lot of stories, and some of them just incredibly heartbreakingly tragic, and some of them infuriating. I'm not going to go into very deep detail with any stories today, because I feel like I've already been up here for a half hour or something.
No, you haven't. You're on time.
Okay, good. I want to tell you that in the last several weeks, even after the event that happened in Delnor Community Hospital, where an inmate was left unshackled for days, was requested to be reshackled, and that request was ignored. And that inmate retrieved a weapon and used it to rape and kidnap. We still have other areas in Illinois where safety is not at all a priority with these inmates. We already know that inmates are a major source of violence in healthcare, but we actually have a story that I received. There was recently an inmate who was allowed visitors. Now, I don't know if you guys know about this, but when inmates are in the hospital, they're not allowed visitors. But this one was. And there has been no effort to pat down the visitors, and the inmate has been allowed a cell phone. And I can't even begin to explain the magnitude of that, because if you're not familiar with corrections and how this is handled, this is a really big deal. You have a guy who is already dangerous and in jail for that, seeing outside people who he can say, this is my mom, and it could turn out that that person's a gang member and supplying him with drugs or weapons. And he's got a phone, and he can use this phone to make arrangements for any outside help that he can find. I don't even need to tell you how big of a deal this is, because this person could single-handedly get the whole hospital shot up. Shot, literally killed, injured. This needs to be addressed. The Department of Justice in this state needs to find some way to work with their contracted hospitals to create safe laws. And I propose, and I don't know if this is realistic here, but I propose that there be a collaborative agreement as part of the hospital and corrections contracts that hospitals actually use a little bit of leverage to say no visitors ever. Always 2 COs, always. And when you have at least one corrections officer there, they need to have what's called a rover, which is a third CO that's at the hospital as well, who rounds on all of their patients from corrections and makes sure that nobody needs a break or anything like that. Because if you don't have a rover and somebody needs a break, you're going to be back down to 1 CO in that room. So, I have a lot of stuff written down. I've been taking notes listening to everybody talk. My goodness, Jim Leslie. Oh.
Yeah.
That. I don't know where he went. He was here a minute ago. I just can't even. My heart is so with him, and there are no words. That's a man who understands. It is hard for us to express to our loved ones how hard it is to do the job we do, to see the stuff we see, to experience the trauma ourselves of abuse. And, So he's a man who gets it. I do think that probably that is all that I have for right now, because that was plenty. But guys, just pull together. Make there be laws. Don't even hesitate on this. Make there be laws. We have this whole group of people here to build momentum. Call people when you get home and say, hey, I think I want to work on something. Will you join me? You know, it only takes one person to start an idea that catches on. I started an idea that caught on. And Illinois, they started an idea and it caught on. I'm glad to have been able to work with them on it. But anyway, guys, it's great to meet you. Thank you to you guys for having me here. And if you want to find me, you can find me at the Healthcare Workers Protection Act page on Facebook. Thanks, Angela. Thank you.